Good evening. What would you do to bridge the gap of health disparities that exist in minority communities? For example, in the Asian American community, cancer is the leading cause of death, where heart disease is the leading cause of death for all other groups. Also, too many times, data does not even report Asian American.
There's a comment, please. That's a good question, thank you. I personally do not know how to solve that issue, and I wish that I did. Again, we do need to look out for the folks that are truly needy and make sure that insurance programs and any government spending are targeted to those, just like the SCHIP program was for children. It needs to stay that way. But it is a legitimate role of government to look out for the needs of communities that need to be taken care of, especially when it comes to the healthcare issues. But I'm sure Mr. Buckley can speak to that much more effectively because he's an expert. So I'll turn it over to him. Mr. Buckley.
Well, I wouldn't say an expert, but I do think we have the greatest university systems in the world in this country. That's one of our really great assets. I think another one of our great assets is we don't have a caste system. A lot of countries, you grow up in a certain family, you're stuck there forever. One of the great things about the United States is anybody can make it. Look at Britney Spears. You know, she came out of nowhere and the super. But I think that there's so many good causes. And you see Jim Martin's website, he wants to take care of Alzheimer's and fund this and that. But there's so many medical problems. How do you decide which ones should get the government's help? I mean, there's all different kinds of illnesses and mental illness problems. You know, who's to decide that this is what we're going to fund? And if you fund them all, you talk about financial problems now, the government will be completely broke. What I suggest is we simplify the tax system the way I described. We continue to allow an income tax deduction for contributions to charities, universities. And so, as of now, I don't know what you all are like, but I constantly get 3 or 4 letters in the mail every day from different charities saying, send us money. And I decide the ones that I think are good charities. And I think that's the best way of handling these problems. Some people might think, Alzheimer's is a great thing to fund. So you send your check and you get a tax deduction. If the tax rate is 33%, the government pays a third of it, you pay 2/3. And just remember, whenever the government pays for something, that means everybody pays for it. And let's offer rewards in these areas. Let's say, hey, if you find a cure for cancer, you'll get a $10 billion award, like the Nobel Peace Prize. If you win the prize, you get a cash award. Let's offer rewards for breakthroughs that are healthcare breakthroughs that help everybody, because that would help reduce the cost of Medicare and Medicaid, and that would help